The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to another episode of The Patient Talks. My name is Frank Smith. I am a family practice physician assistant, a PA for short. Today we're going to be talking about lateral epicondylitis. This is also known as Carpenter's elbow or tennis elbow. So what is that? If you have presented to your clinician with this, odds are you presented with a complaint of pain on the outside part of your elbow that may have traveled up somewhat into the upper arm, but definitely down into the lower arm and is far worse with gripping. The most common thing that a patient will say to me when they come in with it is, Frank, I can't even grab my coffee cup anymore. So what's going on with this? Well, let's start with some basic anatomy. Anytime you feel a knot or a bump on a bone, the reason it is there is it is an attachment point for a ligament or a tendon. The little knot below your kneecap that most women learn to hate when they're learning how to shape is the attachment point for the big muscle in the top of your thigh. It attaches to that knot. When the muscle contracts, it lifts the leg. On the elbow, this knot on the outside part of the elbow, the lateral part of the elbow, is the connection point for several ligaments and tendons that are involved with gripping. In lateral epicondylitis, what happens is that connection point becomes very irritated and inflamed. It usually happens from doing something over and over. The reason it's called tennis elbow is if you imagine the movement that you do with a tennis racket. Or Carpenter's elbow, I have a prop. It's the same idea. We're gripping this hammer and we're moving over and over, and you can see where these tendons get involved. So it becomes inflamed, and anytime you ask it to do its job, it's not happy about it. So your clinician likely talked to you about the basic idea of what it is, and he may have given you or he may have told you to pick up a forearm strap. They look something like this. Little cushion on the inside here, strap that goes around. You place this on your forearm, strap it down to give everything a chance to heal. One of the most common mistakes I will see patients make is they will place the strap directly over the problem, and that's not going to accomplish anything. What we need to be doing is, if you follow this tendon over, we need to be putting the strap over the large part of the forearm here. Now, the reason we're doing that is when we put that strap in place, it allows that tendon to use that strap as its attachment point instead of this place over here on the lateral epicondyle, which gives it an opportunity to calm down. Your clinician also probably talked to you about using ice to the area. He or she may have recommended anti-inflammatories like ibuprofen, naproxen, meloxicam, and may have even talked about a topical anti-inflammatory. Most of the time on this, it works and it's done. If it does, be sure to keep that strap, because it's been my experience that you show me a patient that has had this happen once, I will show you somebody that it will happen again. When you first feel it starting to act up again, put that strap on. Like most things in medicine, caught early, it's a fairly easy fix. Caught late, it's a very difficult fix. Now, if your lateral epicondylitis isn't responding well to strapping it down and using the anti-inflammatories and the ice, your clinician may talk to you about putting a steroid injection into that area. Now, don't freak out. The shot does not go directly into the bone. What he actually will do is move slightly down along that tendon and place the medicine into that spot. And again, it's to help really cool that inflammation down. It's been my experience that probably 90% of patients will respond to either the conservative treatment or that injection. In a very small percentage of cases, it may require more in-depth issues. Also, physical therapy is worth doing on this. I've had patients have very, very good response to PT. But if none of those work, your clinician may talk to you about other options that are available to you. So that's lateral epicondylitis. I hope I've been able to pass on some helpful information. I hope it's been entertaining. If you've enjoyed the show, there's a like and subscribe button down below. Please click those. I'll be back next week. Until then, get better and make me look good. Okay? Goodbye.